Valentina Mocchetti. I'm a speech pathologist dysphagia specialist, and I work in the Department of Otolaryngology just across the street at Weill Cornell Medicine. And I'd like to thank HSS and David here for the invitation to speak about dysphagia today. These are my disclosures. I'd like to just start and acknowledge a particular important team member as well, my physician colleague, Dr. Anais Rameau, who is chief of dysphagia at Weill Cornell. Her and I work very closely together. We work in a multidisciplinary joint dysphagia clinic model. So a lot of what I'm going to review today is not only the speech pathology perspective on dysphagia and myositis, but also from the otolaryngology or laryngology side of things as well. So this is going to be a crash course in dysphagia. I'm going to really try to just introduce some of the things to be aware of, particularly in our patients with myositis, some of the complications that can occur. Talk about a little bit about the evaluation of swallowing dysfunction that, of course, is not just limited to myositis, but you could perhaps get an idea of why evaluation, perhaps early evaluation, is important. Some of the more medical and surgical treatments that otolaryngologists, specifically laryngologists, who are voice, swallowing, and airway specialists can provide, as well as the more rehabilitative side of things that speech pathologists can provide as well. So to begin, swallowing is a sensory motor behavior intended to move food and liquid from the oral cavity to the pharynx and into the esophagus in a safe and efficient way. We can characterize these in three phases: the oral phase, the pharyngeal phase. Those two are really speech pathology and otolaryngology specialties. And then we have the esophageal phase, where we can interlap with otolaryngology as well as our GI colleagues. Just a note on nomenclature about really what is dysphagia. There's a little bit of a debate